You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone podcast. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you for joining me in this week's episode where I am going to talk to you about probiotics, the importance of oral probiotics for great oral health and how they can support you to prevent things like cavities, gum disease, bad breath and more. If you want to know more about holistic dentistry, then you can hop on over to holisticdentistry.au or check out the website of my dental practice, evolvedental.com.au, and that's my dental practice in Brisbane that I have run since 2005, and I've been practicing as a holistic dentist now for almost 23, 24 years. I tend to lose track. But anyway, before we get off on too much of a tangent, today we're going to talk about oral probiotics and why they are beneficial and why so many people should be taking them who aren't. So let's get in the zone and let's get to it. So what are dental or oral probiotics? Well, probiotics are microorganisms that are mainly bacteria, and they provide benefits to us as humans when we ingest them and have them in our body. Now, your gut has loads of bacteria, and without them, we wouldn't be able to digest our food and we wouldn't really have an immune system. So the benefits to us of taking a oral or dental probiotic they range from prevention of bad breath and cavities to improved gum health. Now, probiotics in oral health, it's backed by years of research. Look, there haven't been that many human clinical trials, but there's been a lot of research on the benefits of probiotics for your dental health. Yet, so many people, so many of our patients are unaware of the benefits that dental probiotics can offer. So what are they? Well, oral probiotics are specific strains of bacteria that are known to support a healthy mouth and improve your oral health. They encourage the growth of the good bacteria, which help protect you and help you function normally, and they stop the growth of the bad or the pathogenic or dangerous or harmful bacteria. Just like your gut, your mouth has got this really wide, diverse background and base of bacterial community that we call your oral microbiome. It would maybe shock some people to know there's billions of bacteria in your mouth, and most of them are actually beneficial and good for you. So your dental probiotics, they're similar to gut probiotics, and they use the good, the commensal bacteria, to improve the health of the microbiome in your mouth. They're not the same as the probiotics that you take for your gut. They are slightly different, and they are most effective when you deliver them directly to the mouth. So things like a lozenge that you suck on, a chewable tablet, a probiotic milk or a probiotic drink. That's the best way to get it into your mouth. Oral probiotics in the form of a tablet that you swallow doesn't seem to be that effective. Now, you can get some kinds of toothpaste that have oral probiotics in them as well. So there's different ways to get those good bacteria, the good guys in there doing their job and defending you from the baddies that are going to cause bad breath, infections, inflammation, gum disease, and cavities. Now, an oral probiotic or dental probiotic supplement is going to deliver these bacterial strains that you need directly to your mouth so that they can colonize and live and breed and grow. I know it sounds a bit gross, on the surfaces of your mouth and form biofilms. Now, the use of oral probiotics offer health benefits because of the way they boost the immune system in your mouth. So do they really work, or is it just another one of those gimmicks? Well, yes, they actually do work to improve oral health, especially for people who have what we call dysbiosis. Now, dysbiosis is just a fancy term for a disruption of the balance of the bacterial communities in your oral microbiome. So if you've got too many bad bacteria, you've got yeasts and you've got parasites, you've got candida, for example, that is going to put you at risk of nasty side effects. If you've got lots of good bacteria, they suppress the bad bacteria from being able to breed and actually change the climate. This is good climate change, even though I don't think climate change is real. You can all boo me on that one, but I've seen many different things, but let's not go off on that topic. But we want positive climate change in your mouth, and these probiotics help do that. So they show promise for the prevention of oral disease, and they also cause little to no side effects. And look, there needs to be a little bit more research to work out exactly the best way to get these good guys, these good bacteria into your mouth, and what the right dosages are that you're going to need to get the most specific effect. Well, let's have a look now at the difference between oral probiotics and your gut probiotics. Now, the major differences are the types of organisms that each of these probiotics contain, as well as how they are delivered. Now, gut probiotics contain bacterial strains that are native to your gut and your intestinal tract and your stomach, and they are delivered by capsules that are designed to resist the powerful gastric juices and acids and the acidic pH of your digestive system, so they don't just get destroyed. And survivability is really important when it comes to those gut probiotics. That's why it's important to choose a high quality product with a large number of diverse strains and a high number of colony forming units. And that's written on the packet. It's called CFUs. You want a really big number of CFUs. On the other hand, your dental or your oral probiotics contain beneficial strains that are specific to the oral microbiome. So they're particular to what's going on in your mouth. And look, there's going to be some similarities, there's going to be some commonalities and overlaps, but you really want to be taking an oral probiotic, not just that you take it orally, that you take a dental probiotic that is specific for your oral microbiome. So what should you be looking for? What are the best probiotic bacteria and strains to take? Now, you're going to have to bear with me, and I apologize for my poor ability to speak Latin. I grew up in working class Birmingham. We were learning French. Most of us couldn't even speak proper English because of our dialect and accents, so you're going to have to bear with me. Anyway, the oral microbiome probiotic strains, the ones that are considered most beneficial are going to be your Lactobacillus reuteri, R-E-T-E-R-I, might be, I don't know, I'm not even going to have a go. I'm going to call it reuteri. You can spell it R-E-U-T-E-R-I. Your Lactobacillus salivarius, so like saliva with R-I-U-S on the end. Then Streptococcus salivarius K12, Streptococcus salivarius M18, Lactobacillus paracasei, and Lactobacillus sakei, sakei, I would say, Sakei. So you want your Lactobacillus, your salivarius, K12, M18. K12, M18. Oral probiotics. How are you going to take them? Well, they're usually given in the form of a lozenge or a drink, mouth rinse, or a chewable tablet, something that's going to sit in your mouth, something that's going to stay in your mouth while it dissolves, and it gives it enough time to inoculate your oral microbiome. You want those bacteria to have time to penetrate and get into your mouth. Now, however, the mouth is connected to the rest of your body. I've said that many, many times. If you're a regular with the show or you've been reading any of our blogs, then you'll know that this is a very common theme in holistic dentistry. We talk about the mouth-body connection. So good gut bacteria established from birth and infancy may potentially reduce your childhood risk of dental cavities. And so if your gut microbiome is out and your oral microbiome is out, you are more at risk for dental decay as well as gut issues and allergies and so on and so forth. So I would encourage the use of a gut probiotic and an oral dental probiotic with your Lactobacillus salivarius, your Streptococcus salivarius, particularly your K12 and your M18. So what are the benefits of these dental probiotics? Well, it's going to be pretty general across your mouth because a healthy microbiome is the key to oral health. So this is why we bang on a lot about don't eat too much sugar, don't have too much processed food, don't use harsh mouthwashes continually because you will destroy your microbiome. So we want you to feed your good bacteria the things that they need to eat and starve the bad bacteria of the things that they like to eat. But these oral probiotics, they will help prevent and address most oral diseases such as tooth decay and cavities, gum disease, that's your gingivitis, which is your early gum disease, or your periodontitis, which is the destruction of the gums and the bone that holds your teeth in. It will help prevent candidiasis, so oral thrush from candida. It will reduce bad breath, reduce your risk and prevent respiratory infections, because if you're breathing in pathogenic, nasty bacteria from your mouth, you are likely to get pneumonia and bronchitis and chest infections. Oral probiotics will reduce your risk and prevent tonsillitis and even oral cancer. The good bacteria in oral probiotics create these beautiful biofilms to replace those that are created by the pathogenic, nasty, harmful, bad, undesirable bacteria. And the new biofilms support the health of the teeth and gums and reduce inflammation, and they can block bad bacteria from reaching the enamel and the gums where they want to go on and wreak havoc. Now, we have a bad breath clinic as part of our practice. And what we commonly do for those bad breath patients is we will give them a product that completely wipes out their existing oral microbiome. So we do that and we go, boom, let's just nuke everything, which is not what we would do, on a regular basis. But in this situation, their breath is so stinky, they've got so many nasty bacteria that the only way we're going to deal with it is we wipe them out. So we nuke that out with this oral regime and products, and then we give them the oral probiotics. So we recreate their microbiome so that they're creating great, healthy biofilms to replace those stinky, producing harmful, disease-causing bacteria. But if you've got a generally healthy mouth and you don't have really overt problems, then you don't have to do the napalm, nuke them all, get rid of them, approach, you can just be adding in these oral probiotics, your K2, your M18, and change your bloody diet. Change your diet, cut down the sugar, alcohol, processed foods, give that really big hit on the head. Go natural, wholesome, real food the way nature produces it, and you will see a big change in the health and well-being of your mouth very quickly. Add in some great oral hygiene, and it's that simple. Anyway, so let's look at how these probiotics work for cavities. Cavities, or dental caries, which is the proper name for it. This develops when groups of bacteria form together and cause a layer called plaque on the teeth. And then they feed off sugar molecules, and sugar here is carbohydrate, and they excrete acids that break down and dissolve your tooth enamel. Now, if you address this process early, you can remineralize this weakened tooth enamel and reverse this initial stage cavity with dietary and lifestyle changes. But if you leave it unchecked and you continue feeding those nasty bacteria the sugars that they thrive on, this tooth decay will start to eat into the next layer of your tooth called the dentine, and it will irreversibly damage it, and you will require a filling. If you leave it long enough, it's going to damage the nerve and the blood supply inside your tooth, and you're going to get an infection, and you're going to end up needing a root canal or a tooth extraction. This is why you must have regular checkups. So we pick these things up early, guys. Plug. If you want to book a checkup with us, 0737201811. Oral probiotics prevent cavities and plaque buildup. Now, the best ones for working with reduction of cavities, and again, you're going to laugh at my Latin, is Lactobacillus acidophilus, the paracasei, rhamnosus, reuteri, cassei, salivarius, Bifidobacillus. I'm really having a good time with these. Bifidobacillus and Streptococcus, thermophilus. Stupid names. I had to learn all this stuff for bloody dental school exams. Stupid names. Anyway, I might just write a little bit of a blog on this, or I might actually, when this is, when it's there on the podcast, I'll have it in the show notes, so you can read them for yourselves. That's probably the easiest way to do it. Anyway, research shows that these probiotics can prevent cavities by improving the immunity of the mouth, producing antibacterial compounds that fight certain cavity-causing bacteria. They prevent the bad bacteria from actually attaching and sticking and adhering to the teeth. They alter the pH of the mouth to stop cavity growth, so they make it more alkaline. And then they change the quality of the saliva, which helps to improve the remineralization, the rehardening of the enamel. One of the most problematic bacteria that is involved with the development of cavities is called Streptococcus mutans. However, the oral probiotic strain called Streptococcus A12 helps outcompete the harmful version, and it prevents plaque buildup. Now, in controlled trials on oral probiotics for dental caries, they found that in 75% of the studies, dental probiotics reduced cavity formation. However, the doses and the strains and the study methods weren't the same, so it's really not possible to say, hey, Dr. Rachel, how much of this should I take? Which strain should I have? How long should the treatment go for? I don't know. And I think that your mouth and your case is probably going to be quite different to somebody else's. So this is why we're talking about these mixed bag approaches with your probiotics. So again, I'll put them in the show notes so you don't have to laugh too much at my poor Latin. I do apologise. I'm really good at drilling teeth, by the way, guys. Just can't say the names of these Latin words. And I hope you don't hold that against me. So let's have a look at gingivitis, gum disease, periodontitis. Periodontitis, gum disease, is a chronic inflammatory condition that affects, I would say, between 50 and 60% of the adult population. It's associated with higher rates of things like diabetes, Alzheimer's, heart disease, dementia, strokes, pneumonia, and even types of cancer, such as pancreatic cancer. Once you've got gum recession, once you've got bone loss around your teeth, it is irreversible. You can't reverse it, but you can halt it or significantly slow down the rate of damage. It is so important to stop gum disease before it does lasting damage, because we can't make that bone and we can't make the gums grow back. I don't care how many YouTube videos or things that you watch or listen to that tell you any differently. It is not true. You cannot make that tissue grow back. But 11 or 12 or so thereabouts clinical trials have shown that dental probiotics can improve gum disease symptoms. I've also seen it in my own patients where we get them on probiotics, we make some dietary changes at the same time, and their gum health improves phenomenally, just like magic. Now, the probiotics that are best for gum disease are Lactobacillus reuteri and Lactobacillus brevis, brevis. The improvements that we see from the probiotics include reduced plaque around and under the gum line, less bleeding from the gums, a lower gingival index, which is a marker of gingivitis. It's something that we look for clinically, which is redness, swelling, gums that are pulling away from the teeth and bleeding, smaller pocket depth, which is a measurement that we as dentists use to spot and grade the severity of periodontitis. So the gums actually hold tighter to the teeth because of these probiotics. So I would say using them reduces inflammation, stops bleeding gums, and it crowds out again and crowds out those bacteria that cause gum disease. Lactobacillus reuteri can improve symptoms of gingivitis and gum bleeding, while the L. brevis seems to reduce the inflammation. So again, this mixture, this melting pot approach to hit different angles and different bases to give us the results and the preventive measures that we need. So I'm going to move on now to oral thrush or candidiasis. Now, oral thrush is a fungal condition in which a candida fungus, usually Candida albicans, overgrows and forms white spots on your tongue. It can also be on the roof of your mouth. You can get burning, redness, and dry mouth as a result of this. This fungal overgrowth is a really common symptom of dysbiosis in the oral microbiome. We see a lot in people who've got poor and weakened immune systems, people who are highly stressed, poor sleepers, and people with poor nutrition. Now, the best way to stop oral thrush is to stop giving it sugar and carbs that feed the candida yeast. We just got to starve them. So along with that dietary change, though, if you get some high quality dental oral probiotics, they're going to help prevent or reverse that oral thrush. Changing your diet will stop the candida growth as it's no longer got the food source that it wants. And then the influx of the beneficial bacteria from your probiotic will suppress and stop and drown out any remaining candida microbes. And then your best ones for this are Lactobacillus spp and Streptococcus salivarius K12. So The dental products containing your Lactobacillus species can stop Candida from forming a biofilm in the mouth, and clinical trials found that S. salivarius K12 decreased oral thrush symptoms. It improved inflammation of the oral tissue that you see commonly with people who wear dentures. It's called denture stomatitis, which is a bacterial overgrowth on the actual denture itself that then causes irritation and inflammation of the soft tissues where the denture seats in the mouth. So again, your Lactobacillus species and your salivarius K12, super helpful. When it comes to halitosis, which is bad breath, there's been some studies on dental probiotics, and they found that good probiotics, and this is what we do with our bad breath clinic, the good probiotics reduce what are called volatile sulfur compounds that cause halitosis and bad breath. Other studies saw no improvement in the levels of the VSCs, the volatile sulfur compounds, but the breath odour improved. And I think this is because although the number of those volatile sulfur compounds didn't come down, the good bacteria were helping suppress other things that were going on. They are a much, I can't say it enough, better remedy for bad breath than mouthwash. Mouthwash is just going to mask the odour, and it kills not only bad bacteria but the good ones along with it. So when I recommend mouthwashes for my patients, I recommend things that have got essential oils and anti-inflammatories in that are going to support the good bacteria and not destroy them. So dental probiotics are really good to reduce bad breath producing compounds, and the best ones for this are your salivarius K12, your Lactobacillus salivarius, your Lactobacillus reuteri, your Lactobacillus casei. So again, multifunctional bacterium. Shall I continue? Yes, I will. Respiratory infections. Now, respiratory infections of your respiratory tract, obviously, are caused by a variety of viruses and bacteria, so such as your common cold virus, COVID virus, influenza, sinusitis bacteria, strep throat, and bronchitis. Now, oral probiotics may reduce the risk of respiratory infections, and it's been shown particularly effective in children. And the best ones are your salivarius K12, salivarius M18, Lactobacillus reuteri, sakei, paracasei, and gasseri. God, they come up with some good names, don't they? Animal studies found that the gasseri was able to reduce significant Streptococcus bacteria responsible for infections like strep throat and sore throat. They had 4 times less frequency of infection, and the animals that were given them were less likely to die from the infections than the control animals. Well, that's good to know, isn't it? Little bit extreme. I'm not that keen on animal experimentation. Sadly, it is what has to be done. And again, I'm not going to get into that because I'm going to offend and upset people. So we'll just talk on. Oral probiotic supplement containing a mixture of probiotics reduce the risk of children getting respiratory tract infections by around 75%. So if your kiddie, like my son was one of those who was always getting coughs and colds and snotters, get him on some probiotics, get him on some oral probiotics. Tonsillitis seems to follow on. Now, they're the lymphatic tissue that sit in the throat, and tonsils are there to protect you from bacteria and viruses and nasties. Now, tonsillitis is inflammation of the tonsils. Now, acute tonsillitis is sometimes, what you need because you've got an infection. But if you're getting regular and recurrent or chronic tonsillitis, then things are out of whack. And the best probiotic for tonsillitis is the Streptococcus salivarius K12. And this gives rapid relief of symptoms of recurrent tonsillitis. And taking this also results in an improvement in the microbiome of your upper airways. So double benefit. Now, oral cancer. Oral cancer is something that we are seeing more and more and more prevalently, and this is of concern, and we are seeing it in younger and younger patients. It used to be older patients who were smokers and drinkers would get oral cancer and were more prone to it, but we now understand that bacteria, and in particular papillomavirus, human papillomavirus, will be a precursor for oral cancer, and we're seeing it at younger ages, as I said. So correcting dysbiosis of the oral microbiome may decrease the risk of developing oral cancer, although there aren't really any clinical trials that have confirmed this. But oral probiotic strains have been shown to slow down and sometimes even stop oral cancer growth. Again, these are going to be ones I'm going to struggle to say. Lactobacillus rhamnosus GG, it's not a horse. Lactobacillus plantarum, Acetobacter. Hang on, I should have rehearsed this a little bit more before going live with you here, but I'm not going to keep stopping and starting and editing. I'm going to keep going, and I'm just going to show you that I'm just as human as you are. Acetobacter syzigii. So that's spelled, I don't even know how you say that. Syzigii, maybe. It's SYZIGII. And then lactosalivarius REN. But more research is going to be needed to draw some proper conclusions on, do these things work in the fight against oral cancer? But seeing as taking an oral probiotic is really not going to do you any harm and has so many other benefits, there's no harm taking them. There's no scientific evidence at this stage that oral probiotics can treat or reverse oral cancer in humans. So I'm not trying to make any claims here. It's a hypothetical thing that it may help reduce the risk. I don't know. Well, so how long should you take oral probiotics? How long does it take for them to work? Well, depending on the severity of your dysbiosis, how messed up things are there in your mouth, oral probiotics can work in as little as a week. Most studies have been conducted over 2 to 4 weeks, and there's been some studies that track this for longer, from 9 to 12 months, for example. Now, when I advise a patient to take probiotics, I'm going to say to them 2 to 3 months as a baseline, and probably 3 to 6 months to get things back on track. They've got to change the diet as well, though. And like I said, if we've got someone who's got really bad breath, then we just wipe out what they've got and reintroduce stuff so we can get things back on track as quickly as we can. So how do you take them? Well, the most effective and probably most palatable way is via a chewable tablet or a lozenge. I'm a big fan of a lozenge because it sits there for longer, and these allow the beneficial bacteria to be delivered directly to the surfaces of your mouth, so your tongue, the roof of your mouth, your cheeks, your teeth, your gums, the inside of your lips, down into your throat as well. And this is where the biofilms are formed by bacteria. For good bacteria to thrive, you've also got to eat plenty of prebiotics. Now, the prebiotics are fibers that feed and nourish your probiotic bacteria. And this includes things like onions, garlic, artichokes, bananas, the unripe ones. I hate bananas, so I'm gagging just talking about it. Artichokes, if I didn't already say that, asparagus, chicory root, leeks, jicama. What's that called in jicama. It's like a Chinese radish thing. Yeah. Apples, cocoa, and flaxseed. Now, taking probiotics is unlikely to be effective without the prebiotics presence in the mouth. Other words, you've got to take prebiotics every day for your probiotics to work. Now, should you take them in the morning, your probiotics, or should you take them at night? Well, I think the best time to take them is in the morning after you've finished your thorough oral hygiene routine. And by thorough, I mean brushing, flossing, interdental brushes, tongue scraping, water pick. I've gone over that in previous episodes, so you can go back and revisit that and check in on how to do it. Now, how are you going to choose the best oral probiotic? Well, you want to look for products with a high strain count, which is measured in CFUs, which is your colony forming units. You want a supplement with at least 3 billion CFUs, 3 billion. Keep in mind, though, that oral probiotics are going to have a lower strain count and CFU count than regular probiotics because they're not the same as the ones for your gut. You want to look for a probiotic with the beneficial strain, such as the salivarius K12, the salivarius M18, Lactobacillus rhamnosus, and your Lactobacillus reuteri. Your oral probiotics should not be swallowed. Do not just gulp them down. It's not like taking a tablet. They should be chewed or made to melt in the mouth. Now, you can buy probiotics online. You can get them directly from the manufacturers or health food suppliers. Most oral probiotics are not available at your local grocery or supermarket. You may be able to get them from a health food store. You may be able to get your dentist, particularly a good holistic dentist, to stock them and help you get supplies of them. Now, you can also try taking some probiotic foods that contain probiotic bacteria to enhance the benefits of your oral probiotics. Now, these are things, and I don't like fermented foods. There's so much on it. And again, I'm going to be controversial, and I just don't like fermented foods. I don't enjoy them. Anyway, but I'm going to put them here for you, and it's up to you what you want to do with them. I just think there's too much sugar in the fermentation, and I might be onto something, and I might be completely bonkers. I don't expect everybody to agree with everything that I say. Otherwise, I wouldn't be bothered doing these podcasts. I wouldn't be standing to the side of my profession and saying, hey guys, I don't agree with everything you do. You don't have to agree with everything I say. But if you can take some bits from the dental zone and go, you know what, that makes sense, that seems to work for me, and you apply that to you and your life, then fantastic. If you don't like it, don't listen. Fair enough. Anyway, you can take kombucha, kimchi, yogurt if you're Australian, miso, natto, sauerkraut, and kefir. There are no published studies that prove these foods will work the same as a targeted probiotic for your oral health, but they may offer some benefits for your overall health. Now, are there any side effects of dental probiotics? Well, they shouldn't cause any side effects. One of the benefits is that they are extremely safe. Some gut probiotics can cause stomach upset and bloating. We haven't seen those sort of things for your oral probiotics. If you have a condition that compromises your immunity, such as cancer or inflammatory bowel disease, then I would always encourage that you speak to your GP or your healthcare professional before you start adding anything in as a new probiotic regime. Now, your oral microbiome, just to give you a bit of background for anyone who's interested, it's made up of over 700 different known species of bacteria that live in the biofilms of your mouth. So these live on your teeth, your lips, your tongue, and your hard palate and your soft palate, floor of your mouth, as well as your cheeks. And they serve your mouth's immune system. A healthy oral microbiome reduces the rates of tooth decay, periodontal disease, oral thrush, and bad breath. Dysbiosis, which is the fancy word for imbalance of the oral microbiome, can result in inflammation and higher risk of any oral disease. Now, there's been a lot of talk in recent years about gut microbiome, how important it is for your whole body, for your digestive health, and I believe your oral microbiome is as equally important. If you can balance your oral microbiome, it's going to benefit your mouth. Those healthy microbial colonies will reduce your risk of many systemic disease, because a dysbiotic oral microbiome is associated with not only dental disease, but problems like cancer, diabetes, heart disease, poor pregnancy outcomes like miscarriage, preeclampsia, low birth weight, cognitive impairment, not from pregnancy outcome, but these are in the list, cognitive impairment, pneumonia, Alzheimer's disease, and obesity. Now, there are specific strains of oral microbiomes associated with each of these diseases. And with predictive testing, your dentist can even test for the presence of these in your mouth and identify if you've got an increased risk for any of these diseases I've just mentioned. Your oral cavity and the microbiome in there is a gateway to the rest of your body. Everything that goes through your nose and mouth passes through your oral cavities, which is home to millions of microbes that make up your oral microbiome. In addition to those microbes that live in your mouth, you swallow over 1 trillion microbes every single day, and these pass through your oral microbiome and travel down to your gut microbiome, and in the process inoculating and reseeding both areas. Now, depending on the health of your oral microbiome, certain bacteria may make it through the initial checkpoint and have a major say in your overall health. And this is why a healthy oral microbiome is so important. Your mouth needs to maintain an ideal ratio of good to bad bacteria, because that's going to directly determine your oral and dental health, as well as impact on the health of your entire body. So, after listening to me going on and falling over all the Latin words, which I hope hasn't annoyed you and maybe has given you a little source of amusement, are dental probiotics right for you? Well, you can't just take them in lieu of poor oral hygiene. Like you can't exercise your way out of a bad diet, you can't oral probiotic yourself out of poor oral hygiene. You have got to clean your mouth well. You need to be on a healthy diet, and you need to be having your regular 6-month cleaning. Just because you take a probiotic, it doesn't wipe out the need for good oral hygiene, a healthy diet, and regular hygiene appointments with your dentist or your oral hygienist. But if you use these probiotics with your other oral health care strategies, then they're going to provide a significant benefit to your oral and overall health. The health of your mouth and the oral microbiome impacts the rest of the body in ways that science is only just beginning to glean. They're only just starting to get an inkling and an understanding of how important mouth and dental health is for the rest of your body. Your body is a complex system of interactions, and none of them work in isolation. Everything works together. Your body is a whole. And so what's happening in your mouth is happening in your body. What's going on in your body is going to impact your mouth. And anything that you can do to improve your oral health, improve the condition of your overall health is a win-win. So if something as simple as taking a dental probiotic helps you get on top of your oral health and helps you make those changes, then I am all for it. Thank you so much for listening. This is the Dental Zone. I am Dr. Rachel Hall. I'm a holistic dentist in Brisbane, Australia. You can find out more, evolvedental.com.au. And if you would like to see me and become one of our awesome patients, then 0737201811. So go and have a look. See if you can get your K12, your M18, and all those bacteria with the funny names that I couldn't say. And until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.